Welcome to the Living Well During COVID-19 training, part 3. We hope you enjoyed the training and it helps support you to live a healthier, more active life. Living Well During COVID-19 training, part 3 covers infection prevention, mental well-being, self-care and goal setting.
Now we shall move on to infection prevention. Learning to properly take care of your body is one of the most important life skills you will learn. Proper personal hygiene requires you to take care of your body to prevent illness and keep your body healthy and clean. Practicing good personal hygiene can also prevent the spread of germs to others. Personal hygiene does not always refer to keeping your body clean, but also extends to the spaces where you live and work. Some of the things we can do to help prevent illness and the spread of germs are covering coughs and sneezes, hand washing, social distancing, and face coverings. It is important to remember to cover your mouth and nose with disposable tissues when you cough or sneeze. If you do not have a tissue, sneeze into the crook of your elbow, not into your hand. Dispose of tissues into a disposable rubbish bag and immediately wash your hands with soap and water for 20 seconds or use hand sanitizer. You can click on the link for a film on hand washing, or alternatively it will be talked about in further detail on the coming slides. Social distancing, hand washing and covering coughs and sneezes remain the most important measures to prevent the spread of COVID-19. Face coverings do not replace these. Clean and disinfect regularly touched objects and surfaces using your regular cleaning products to reduce the risk of passing the infection on to other people. Wash your hands more often than usual, for 20 seconds, about the same time it takes to sing Happy Birthday twice, using soap and water or hand sanitizer if soap and water are not available. This should be done particularly after going to the toilet or changing a nappy, coughing, sneezing and blowing your nose, before you eat or handle food and after handling raw food, after touching pets or cleaning their cages, or when you get to work or arrive home. Washing your hands properly removes dirt, viruses and bacteria to stop them spreading to other people and objects, which can spread illnesses such as food poisoning, flu, diarrhea or COVID-19. As well as making sure we wash our hands for 20 seconds, it is important to make sure that all parts of our hands have been washed. Quite often we can miss certain parts of our hands. On this slide you can see 6 steps to follow with both hands to make sure our hands are properly washed. Once you have wet your hands and applied soap, rub your hands palm to palm. Follow this with the back of both hands and the back of all fingers. Make sure you rub in between the fingers and the thumbs on both hands and the tips of all fingers. Rinse your hands well and dry. Social distancing means having less contact between you and other people. This is to stop or slow the spread of COVID-19. It is important to maintain a space of at least 2 meters from people outside your household or support bubble. To help you remember this, it is about 3 steps. You should keep distance in public spaces, shops or anywhere where there are people from other households. If this isn't possible, remember to wear a face covering. Keeping a distance of 2 meters away from other people is important as contact with individuals from other and different households spreads the virus. Remember to keep up to date with national and local restrictions for current guidelines. Face coverings should be worn in public spaces, shops, in public or where social distancing may be difficult or not possible, and where you will come into contact with people you wouldn't normally meet. By wearing a face covering we can protect other people as you may be infectious but not have symptoms. Some people are exempt from the rules, including children under 11 are exempt from the guidelines but may wish to wear one, however under the age of 3 should not wear one. People with disabilities, those with breathing difficulties, anyone with someone who relies on lip reading. It is important to wear your face covering in a safe and effective way, remembering to wash your hands before and after wearing it. When wearing a face covering, we should ensure that it covers both the mouth and nose. Please click on the link above for guidance on how to wear one safely. Remember, hands, face, space. Let's have a quiz. Question number 1. How long should you wash your hands for? A. 10 seconds, B. 15 seconds, or C. 20 seconds? Question number 2. If you don't have a tissue and you need to cough or sneeze, should you A. cough into your hand or B. cough into the crook of your elbow? Let's have a look at the answers. Question 1, 20 seconds. And question 2, cough into the crook of your elbow. Take a look at the links on this slide. Here you will find information about protecting yourselves and others. There's also links about local and national guidelines and restrictions regarding COVID-19. In many ways, mental health is just like physical health. Everybody has it and we need to take care of it. Good mental health means being generally able to think, feel and react in the ways that you need to and want to live your life. But if you go through a period of poor mental health, you might find the ways you've been frequently thinking, feeling or reacting become difficult or even impossible to cope with. This can feel just as bad as a physical illness or even worse. Mental health problems affect around 1 in 4 people in any given year. They range from common problems such as depression and anxiety to rarer problems such as schizophrenia and bipolar disorder. If you cannot cope with day-to-day activities, make sure to have a chat with your GP, especially if you feel you are getting worse. Our mental well-being can change from moment to moment, day to day, month to month, or year to year. Take a moment to think about your own mental well-being and the things that affect it. COVID-19 is affecting all of our lives and we will all feel and respond differently to this. You may feel worried or anxious about many things, for example your health, your friends and your family, or your finances. You may also feel lonely, low in mood or stressed. These feelings may come in waves or might be there a lot of the time. It is important to remember that it is okay to feel like this and there are many things we can do to support our well-being. Let's think about how you might be feeling. Anxiety can cause many different symptoms. It might affect how you feel physically, mentally, and how you behave. It's not always easy to recognise when anxiety is the reason you are feeling or acting differently. You may have physical symptoms such as faster, irregular, or more noticeable heartbeat, feeling lightheaded and dizzy, headaches, chest pains, or loss of appetite. There may be mental symptoms, feeling tense or nervous, being unable to relax, worrying about the past or future, feeling tearful, or not being able to sleep. Anxiety can create changes in behaviour, not being able to enjoy your leisure time, difficulty looking after yourself, problems concentrating at work, struggling to form or maintain relationships, or worrying about trying new things. If you experience sudden, intense anxiety and fear, it might be the symptom of a panic attack. Other symptoms may include feeling that you're losing control, sweating, trembling or shaking, shortness of breath or breathing very quickly, feeling sick. A panic attack usually lasts 5 to 30 minutes. They can be very frightening, but they're not dangerous and should not harm you. If you are worried or the panic attacks suddenly happen more often, please contact your GP. If you have a general low mood, it may include feeling sad, anxious or panicky, more tired than usual, or unable to sleep, angry or frustrated, low on confidence or self-esteem. A low mood often gets better after a few days or weeks. It's usually possible to improve a low mood by making small changes to your life. For example, resolving something that's bothering you or getting more sleep. If you have a low mood that lasts 2 weeks or more, it could be a sign of depression. Other symptoms of depression may include not getting any enjoyment out of life, feeling hopeless, not being able to concentrate on everyday things, having suicidal thoughts or thoughts about harming yourself. Finally, stress. Stress can cause many different symptoms. It might affect how you feel physically, mentally, and also how you behave. It's not always easy to recognise when stress is the reason you're feeling or acting differently. Physical symptoms include headaches or dizziness, muscle tension or pain, stomach problems, chest pain, or a faster heartbeat or sexual problems. Mental symptoms may include difficulty concentrating, struggling to make decisions, feeling overwhelmed, constantly worrying, or being forgetful. Remember, it is okay to be feeling like this and there are many places you can get support. Here we can see information from Mental Health First Aid England about sources of stress. There are many different things which can affect our stress and mental well-being, from life changes, emotional, physical, environmental reasons, or changes at work. It can be very difficult to learn how to tune into your stress levels, but while you're working out how to cope with the situation, talk to someone. Take a moment to look at the slide, think about your own mental well-being and what might affect it. Looking after your mental health isn't something you should only do if you're struggling, feeling low, anxious or stressed. It's actually something you should think about all the time and really invest in, the same way you look after your physical health. Here are some top tips from the One You website. Reframe unhelpful thoughts. It's not always easy to spot the links between our thoughts, feelings and behaviours, however they are linked and can affect each other. For example, if we are feeling angry, we may behave more aggressively, whereas if we're feeling happy, our behaviour will be much more friendly. If we can recognise when we are having unhelpful thoughts, we can replace them with more helpful ones. During the pandemic, you may have often found yourself having unhelpful thoughts which create worry and anxiety. By reframing these, we can try think of some of the positives which have arisen, such as appreciating friends and family or the community spirit. Be in the present. All too often we get caught up in life without being able to give any time to our thoughts and feelings or what's around us. By being able to be in the present, we can help our own mental well-being. One way to do this is to focus on mindful breathing. Get good sleep. There are so many benefits of getting a good night's sleep, both physically and mentally. Getting into a good sleep routine and avoiding caffeine are just examples of how to improve your sleep. Follow the link at the bottom of the slide to give you more ideas. Connect with others. During the pandemic, many people may have felt lonely or isolated, even if they're living with someone else. Connecting to others, whether it's family, friends, neighbours or work colleagues, can improve our mental well-being and help prevent us from feeling unwell. This doesn't have to be face-to-face. With technology, it could be a telephone call, video call or messages. The video on the link gives you more ideas on how to stay connected, for example, setting specific dates and times. If you feel as though your mental well-being is getting worse, or if you're struggling to see any positives, you can also call Guideline on 01274 594 594, 12 p.m. till 12 a.m, or some people may prefer to speak to their own GP. These details will be on the further links page shortly. Live a healthy life. What's good for your body is good for your mind. Living a healthy life helps to keep us physically healthy, which has a positive impact on our mental well-being. Through this training, you will have learned a lot about what is good for your body and ways to live more healthily, such as eating better, being more active, and cutting down on smoking and drug use. Do something for yourself. By doing something for ourselves, whether that's enjoying your favourite hobby, learning something new, or even taking the time to relax, can really benefit our mental well-being, especially during stressful times such as a pandemic. Learning new skills can be a great way to connect with others, build your self-esteem and feel a sense of achievement. Having talked about these 6 tips to improve your mental well-being, take a moment to think about one thing you could change or start working on to improve your own mental well-being. It's time for a short quiz. Although this may have not been covered in the previous slides, take a moment to think about these mental well-being statistics. Number 1. How many people in the UK will experience a mental health problem every year? A. 1 in 8, B. 1 in 4, C. 1 in 2. Question 2. What proportion of people with mental health problems experience stigma? A. 90%, B. 50%, C. 10%. Let's have a look at the answers. So question 1. 1 in 4 people in the UK will experience mental health problems every year. Question number 2. 90% of people with mental health problems experience stigma. There is a lot of support available for you to support your mental well-being both locally and nationally. Don't forget, you can also speak to your own GP or even friends and family. Take a look at these links for further information.
We're now going to have a look at self-care. So what is self-care? It's about you, your family and others taking control and looking after yourself in a healthy way. It could be brushing your teeth regularly, taking medicine when you have a cold, or taking part in some physical activity. Self-care is also about being able to find information, advice and practical support to prevent or manage common conditions such as headaches, colds and flu, or manage long-term conditions better such as asthma or diabetes. What does self-care mean to me? Self-care relates to a wide range of activities, choices and decisions that you make on a daily basis to maintain your physical, mental and emotional health, such as being independent and taking control and responsibility for my own health. It's about leading an independent lifestyle for as long as possible and being able to take care and look after myself, or looking after yourself and knowing how to do it properly. Taking up some physical exercise, eating a balanced diet and having an active social life can all help to promote good health, make you feel better about yourself and enable you to be as independent as possible. If you have a long-term condition such as diabetes, heart failure, dementia or COPD, then managing your condition well can help you to take control and live your life as you choose. It's about having the right information and learning the skills you need to help you to manage your condition and, most importantly, your life. Having good self-care means that you are better informed about your condition, better prepared for everyday challenges, better supported when you need it. If you have a long-term condition, there are extra things you may need to consider, such as making changes to your diet, different types of exercise, or different types of medication you may need to take. When you talk to your doctor, nurse or care provider about your condition, you may want to discuss some of the things you need to do to stay well. Some of these things you can do yourself, such as eating healthily, exercising, taking your medicines at the right time. Your local pharmacy can prescribe over-the-counter medication, give advice or, where appropriate, give you medicines that will help clear up the problem. If you are entitled to free prescriptions, these medicines will also be free of charge. They can also offer free health checks and provide access to stopping smoking, sexual health and alcohol support services. If your problem is more serious and needs the attention of a doctor, your pharmacist will recognise this and advise you to see your doctor instead. Certain conditions require a visit to the GP. Examples of these are wound and dressing care, muscle and joint injuries including strains and sprains, minor cuts and infected wounds. Every year, millions of us visit our GP with minor health problems that our local pharmacist could resolve. It's estimated 50 million visits to the GP are made every year for many common illnesses such as coughs and colds, earache, back pain, headaches, strains, sprains and many others. By visiting your pharmacy instead, you could save yourself time and trouble. Instead of booking and waiting for a GP appointment, you can visit your local pharmacist anytime. Just walk in. An accident and emergency department, also known as emergency department or casualty, deals with genuine life-threatening emergencies such as head injury or loss of consciousness, deep cuts requiring stitches, something in the body that shouldn't be there, suspected broken bones or heavy bleeding, persistent chest pain or difficulty breathing, overdose or poisoning, severe allergic reactions and strokes. How can I take better control of my health and well-being? Well, let's spend a few moments to think about what is important to you, what you would like to change to be more healthy and how you could do this. To help you with this, have a think about the following. What's important in my life at the moment? What's working well or not so well? What would make life better for me? What's making me unhappy or stopping me from doing what I want to do? And if I can't do it myself, who might be able to support me to make the changes or improvements I want to make? Let's spend a few moments reading through the slides and looking through the top tips for self-care. Let's test our knowledge on self-care. So what does self-care mean? And secondly, if you have a cold, what should you do? what does self-care mean? It's about you, your family and others, taking control and looking after yourself in a healthy way. It means something different for everyone, and it's about what you can do rather than what you can't do, such as brushing your teeth regularly, taking medicine when you have a cold, or taking part in some physical activity. It could be reading a book, listening to music, seeing friends, or getting plenty sleep, or cooking. And if you have a cold, what should you do? You should visit your local pharmacy. Your local pharmacy can prescribe over-the-counter medicines as well as giving advice. If they think your problem is more serious, they can advise you to go and see your GP. If you want to find out more about self-care, you can find some useful links here on the slide. We're now going to have a look at goal setting. So once you know what it is you want to change and where you are in the change process, what is the best way to go about making changes? It's goal setting. Goals are part of every aspect of life and provide a sense of direction, motivation, a clear focus and clarify importance. By setting goals for yourself, you are providing yourself with a target to aim for. We need to set goals for ourselves that are more likely to help us to be successful. A SMART goal is used to help guide goal setting. SMART is an acronym that stands for S, specific, M, measurable, A, achievable, R, relevant, and T, timely. A SMART goal incorporates all of these criteria to help focus your efforts and increase the chances of achieving your goal. So let's break it down and work through the acronym. S, specific. Goals that are specific have a significantly greater chance of being accomplished rather than being vague. For example, a general or vague goal might be, I want to do more exercise. A more specific goal would be, I will go for a walk. M, measurable. You must be able to measure your progress of a SMART goal. If you don't measure progress, you will not be able to determine how successful you have been or if you are on track to reach your goal. For example, building on the specific goal, I will go for a walk. In order to help determine your progress and measure it, you could say, I will go for a walk 3 times a week and each walk will last for 30 minutes. By making it specific and measurable, you will be able to see easily whether your goal is working or not. A, achievable. A SMART goal must be achievable. It should challenge you, but not enough to make it unachievable, as failing to achieve a goal could have a negative effect on your motivation to continue. For example, I am going to walk for 3 hours every day is probably unachievable for most people. R for relevant. A SMART goal must be relevant to what you are trying to achieve and have a clear link between your goal and how this will impact positively on your health. For example, if your overall goal is to lose weight, then a SMART goal of going for a walk 3 times a week for 30 minutes each time would be relevant as it is helping you to achieve your overall goal. Also remember that it is only relevant if it's something you are not already doing. If you are already going for 3 30-minute walks a week, then your SMART goal needs to be something different or a little more challenging in order to help you reach your goal. T, timely. Your SMART goal needs to have a time frame in which the goal can be achieved. If you don't have a time frame, there will be no sense of urgency and less motivation to achieve your goal. Also, if there is no time frame, it isn't possible to review whether you have been successful or not in achieving your goal. For example, I will go for a walk 3 times a week for 30 minutes each time, and I will review in 1 month's time. After 1 month, you will be able to review whether you have managed to stick to your goal or not. If you haven't managed to stick to your goal, then don't look at this as a failure. Instead, have a think about why it hasn't worked and how can you change your goal to make it more achievable. Sometimes setting some mini SMART goals means you can take small steps to achieving a more ambitious goal. When setting SMART goals, it is a good idea to explore importance, confidence and any barriers. Firstly, on a scale of 0 to 10, 0 being the lowest and 10 being the highest, how important is it to make the change? Secondly, on a scale of 0 to 10, 0 being the lowest and 10 being the highest, how confident do you feel to make the change? People are most likely to successfully undertake the action and achieve their goal if their confidence is 7 or greater. If your confidence feels quite low, explore reasons for this and any barriers standing in your way, and try and identify steps to manage these. Rehearse the situations in your head and write down how to deal with them. You're more likely to achieve your aims if they really matter to you, so try to picture the ways in which you could make your life better. Now we've looked at what SMART goals are and how to set them. Take a look at the goal setting scenarios on the slide and have a think about whether the goals are SMART or not. So let's have a look at the different scenarios and see whether they are SMART or not. So we have 3 scenarios which are SMART goals, and they are: Mark is going to swap an unhealthy snack for a piece of fruit on 5 days of the week. As part of Neela's breakfast, she's going to include a piece of fruit on at least 5 days of the week, and Joe is going to use semi-skimmed rather than full-fat milk on 3 days next week. Those 3 scenarios are all SMART goals. The other 4 are not SMART goals. So Ibrahim's dad tells you that he is going to eat more healthily next week by eating less fried food. Johnny sets himself the goal of walking to school every day next week. He lives 3 miles away from school and currently does not walk anywhere. Zeenat's goal is to stop eating biscuits, and Karen says that her goal is to eat 5 pieces of fruit and vegetables every day. She's a vegetarian and she already does this. These ones are not SMART goals because they are either not specific, measurable, achievable, relevant, or timely. Take a look through them if you are unsure and just work through the acronym to see which part of the acronym they do not meet. Take a look at the slide to find some top tips to help you with your goal setting. If you would like some further support with goal setting, take a look at the slide for some links. If you are interested in further training, the Living Well Academy offers the following training. Making Every Contact Count, or MEC, is a free brief interventions training course suitable for professionals, practitioners, employees, champions or volunteers who work with the public to enable them to have appropriate conversations to motivate, encourage and support people to improve or change their health and well-being. Making changes such as stopping smoking, improving diet, increasing physical activity, losing weight, reducing alcohol consumption, healthy aging and improving mental well-being can help people to reduce their risk of poor health significantly. Making Every Contact Count is an approach to behaviour change that utilises the millions of day-to-day interactions that organisations and people have with other people to encourage changes in behaviour that have a positive effect on the health and well-being of individuals, communities and populations. The MEC approach has the potential to change how you have conversations with your neighbours, friends and family members, and can also impact positively on your own health behaviour. Royal Society of Public Health Level 1 Health Awareness is a free training course which is suitable for anyone wishing to better understand their own health and the health needs of their family and friends. The course will help you to make healthy lifestyle choices for your health and well-being, and also better understand what services are available to support health and well-being. The training course is also suitable for practitioners or volunteers and will enable them to have appropriate conversations to motivate, encourage and support people to improve or change their health and well-being. RSPH Level 1 Health Awareness is an accredited training course. Royal Society of Public Health Level 2 Understanding Health Improvement is a free training course which is suitable for practitioners, staff, champions or volunteers who work directly with the public or employees in a supporting role. The training course will enable you to have appropriate conversations to motivate, encourage and support people to improve or change their health and well-being. The course will also help you to make healthy lifestyle choices for your own health and well-being and that of your family and friends. RSPH Level 2 Understanding Health Improvement training course is accredited. Henry aims to give babies and young children under the age of 5 a healthy start in life and protect them from the physical and emotional consequences of obesity. The Henry Core training covers the principles and practice of the Henry approach to preventing child obesity, with a particular emphasis on developing practitioners' support skills in work with parents and carers of young children. It covers the 5 elements of a healthy start: parenting, lifestyle habits, nutrition, physical activity and emotional well-being. A Healthy Start in Childcare provides a practical introduction to the knowledge and skills needed to contribute to a healthy start within childcare settings, particularly suited to nursery and daycare staff and childminders. If you are a parent of a child under 5 and would like further information or support to attend a parent programme or Starting Solids workshop, contact Henry at bradford.gov.uk.
For the final slide of the training, take a moment to think about your own well-being. From all the areas which are being covered, is there anything which you have thought that you might like to change? Don't forget to think about what your £1 million reason would be to make that change. Do you need any support with these changes? It might just be support from friends or family, or you might prefer to have more professional support. There have been links through the training for local and national support which you can follow, or if you want support from the Living Well service, you can follow the link on the screen to the website or call 01274 43 8884.